and this is COVID and CSU. I'm not sure where that lady is gone. But anyway, these are sort of a couple of questions that I put, and you can give me your comments if you like. And I presented this before and to other groups about, biologics in general, omalizumab specifically, and this is related to the omalizumab in CSU in the pandemic. So do patients with CSU have increased risk of getting coronavirus? And the answer is no. There's no evidence that this is the case. What's about the urticaria exacerbations? Exacerbation during the COVID treatment should be, and change, of course. Should patients with severe CSU stop omalizumab treatment? They shouldn't, and we've proven right in that. Any biologic should be stopped as there is no evidence that these suppress immunity. During the pandemic, we've asked patients to, if the availability of home treatment is there, we ask them to stay and take their medication at home. But otherwise, there is no way of us, telling patients to stop their biologics. Now, remember, biologics are not immunosuppressants, but immunomodulators. They modulate the immune system. They don't suppress the immune system. Can I start omalizumab for our new patients? Yes, you can during these times. There's no problem, and we've done it during the pandemic, where, the peak of the pandemic, we did that. How do we do it at CCA during the challenging times? We did lots of telemedicine during the pandemic. Like most of you, I'm not sure who didn't do telemedicine. Telemedicine has changed actually the face of medical treatment, so we do more of it, or we did more of it at that time. However, the interesting bit is that our patients on biologics kept coming to the clinic. I remember that a patient comes from anyway, a remote area between Abu Dhabi, Dubai, and Al Ain, somewhere there, and she uses, during the pandemic there were lots of checkpoints, and she actually goes through the checkpoints to come in for her biologics to the clinic. And so these patients were adamant to come because they felt better on the biologics. We didn't have any dropouts. There's no dropouts. You can correct me, Mohamed, if I'm wrong, but there are no dropouts. Biologics patients continue to come to our facility with no issues. Okay, so this is, I think this is probably my final slide. This is a study this is a very clever study that was done by a Turkish immunologist, where examined the impact of COVID-19 pandemic on the management course of chronic urticaria. And yes, chronic urticaria actually sorry about that. So chronic urticaria had really significantly impacted the management of patients with so COVID has significantly impacted the management of chronic urticaria. So I'm going to go through this first, the lower panel first. So the weekly number of so this is, I was involved with this. It's like a questionnaire that was sent to 95 UK centers throughout the world, and we were part of it, and it involved thousands and thousands of people. And the study was interesting. So the weekly number so it looked at two elements: CSU patients cared during the pandemic, and what was the effect of the pandemic on patients with chronic urticaria. The take-home message from the top panel is that patients with severe COVID had significant exacerbation of urticaria, which makes sense because infections are known to cause disease exacerbation. The interesting bit here is that the weekly number of CSU patients treated was reduced by 56%. So that was really a great reduction. Half of the patients with CSU during the pandemic didn't attend for their treatment. Furthermore, face-to-face consultation was reduced by 62%. Remote consultations was increased by 600%. Look at the administration of omalizumab during the pandemic. So there was no problems. So it was steady, no issues at all, while patients treated with cyclosporin and corticosteroids have reduced. So yes, COVID had an impact on patients with chronic urticaria, and the impact was really significant. I think this is my last slide, and with that I conclude our presentations, and I'm happy to take any questions or comments from the audience.
One is the COVID things we saw in bacteria. One is some patients with remission after COVID infection have relapsed, and two is new onset of bacteria in 1 to 4 weeks after COVID. So it would be interesting to see all the data together. The question is one is if I have to COVID infection, how long will it stop and result in what is not? Patient has CSU is not COVID infection. So how long will you wait?
Again, Ravi, there's no published data. Probably after the quarantine, when they're better, I would put them 2 weeks. Yeah, I would put them back on the medication because again, this is not an immunosuppressive agent. It controls. Yes.
So what would be the protocol for that? With CSU or not control and have vaccination of
this is an important issue. I mean, the lady that asked, is COVID vaccination contraindicated in chronic spontaneous urticaria? And the answer is no. Because now, if you look at and this is what we tell our patients, this is what we've agreed on in Cleveland Clinic. Yes, you can give the vaccine to don't give it, probably try to avoid when the patient is having an acute flare-up, for example. You need to avoid. But overall, chronic spontaneous urticaria is not a contraindication to the vaccine.
And the not good for the vaccine.
Exactly. Now, this is again expert opinion. No need. There is no evidence. We had this discussion again with various experts in the area, and they said, look, some give the vaccine 2 days later. Some wait for 24 hours and give the vaccine. So there's no right or wrong about this. Expert opinion on it. So what we do normally is that we'll say, look, 1 week, 5 days, 1 week between the 2 doses if they're on a 2-weekly dose. But I think there's no rule. And I think, we shouldn't be afraid of giving omalizumab during the pandemic. We should give it and keep giving it. And because it's really important. Yeah. We're doing a study, actually. My colleague, Dr. Salvo, who actually looking at this and the effect of the vaccine on patients with chronic urticaria. And it's a simple questionnaire. We've managed to have 100 patients on it, but we need to analyze the data and see if there is but from this study that I showed you, yes, severe COVID had actually had caused severe exacerbation. So yes, because of infection, etc. I mean, it's not surprising anyway to see that, or to see patients exacerbating while with infection. Of course, yes. Disasters, yes. Exactly, yeah. Correct. Dr. Habib.
Some of the reasons that they had coronavirus vaccines and they had bacteria, and they just come from the second dose.
No. We get a lot of, look, and now we're getting the worst patients who wanted to be exempted from the vaccine because now they can go to shops, they can travel, etc. So be careful with that. I mean, I myself and Mohamed and my other colleagues, we don't give these. Patients will give you, I mean, some patient came and said, look, I've been coming to you, a recommendation of Sheikh Mohamed bin Zayed and the Mubadala chair, the Mubadala, Rais Mubadala, CEO Mubadala. They asked me to go to you to give me the exemption. I said, well, neither Sheikh Mohamed nor Mubadala CEO spoke to me about you. Tell me what can I do? They try different ways of trying to get the vaccine. So the vaccine the benefits of the vaccine overweigh the side effects. So this message has to be got across to the patients. Unless, I mean, I haven't been given, I'm talking about my practice, I haven't given the vaccine exemption only for 3 patients. One had significant vaccine-associated induced encephalitis, and she was in ICU for about 2 weeks. And there was a link there to the vaccine. She has an exemption, of course. And the other 2, I can't remember what they were. And otherwise, no exemptions. All patients should get it. We have given it to patients with a primary immune deficiency. Patients have no immune system or they can't mount an immune response to any patients with severe asthma, severe eczema. There's no issue. What I tell patients, we can't guarantee side effects. Side effects happened to me, for example, when I took the vaccine. But don't give exemptions haphazardly. And now, as I said, you'll be facing with the worst patients because now, khalas, they've exhausted all hiyal, and then they come to you and say, look, doctor, the last chance. So vaccines are important. The way out is vaccination. Sure.
First of all, we'll start with the era of COVID infection. Cases of urticaria, skin infestation with COVID infection was well established and well documented internationally.
Yeah, we've shown that, yes.
And I think this could be linked to came from hospitals actually. It's not from hospitals. It could be linked to the drugs that's been given or it is provided. But now when we started the era of having COVID vaccine, the urticaria cases are increased. So
the problem is you cannot link. You can't. There's no evidence that they're linked. Oh no! Look, there's no. There's no link. We have to give me an evidence-based link. Yes, adverse effects to the vaccine. But by the way. Look, I'm sure you've seen patients who say, doctor, I am allergic to the drugs. I'm allergic to vaccines. Do you know that allergy, true allergy as we know it, as defined by, this is a type 1 hypersensitivity reactions to medications and vaccines is extremely rare. It is less than 1% in real life. Okay, so all what we see are adverse effects. It happens to you, it happens to me, it happens to the third person. But that does not mean that we shouldn't be given the vaccines. The vaccines are really the way out of COVID. And for example, in this era, the vaccines are the way out. And yes, adverse effects happen, but we can't guarantee them. But as I said, the benefits overweigh the adverse effects. So that I go with the benefits. Of course, go ahead. Yes.
I would request that we have a better system from us to keep them because all patients when we are sending for they are finished and will take 2 months apart. Or they will be sent to a GP or somewhere before these enter the
Well, I tell you, thank you very much for bringing that up. We're running like headless chicken in the clinic. We're the victims of our own success. So we developed, there was nothing 7 years ago. Now the waiting list is about 3 months or 5 months. We're short-staffed, but there are 2 other people joining us, hopefully by June, July, and hopefully the waiting list is less, or will be reduced, I hope. But and now we're going to open the pediatric service, which again Dr. Hamad is going to lead, and this is going to take Dr. Hamad from us adult allergists. And it will be even more difficult. So unfortunately, this is not, by the way, this is not only here, even abroad. There's scarcity of immunologists, allergists throughout the globe, if you like, real allergist, immunologists, and it's an issue. It's a problem. But the only way to do it, if you are concerned about the patients, you can bring us or Dr. Hamad, or text us about patients and we always accommodate patients. There's no issues at all. Now the problem is, as I said to you, we see a lot of these people who want to not to be vaccinated for no reasons, And this is the thing, we've no time for these people because this is, you know, a government initiative, and let alone the government initiative, we believe that the way out is vaccines to get out of the pandemic. You have to, I think you have to be very strict. Yes. I think, in my view, no exemptions except only for rare patients.
There is a family history of Urticaria, or the one that she had or he had in the past, but otherwise were. So what I think that the vaccine has just set it up. This is one. The second one, even if you have after the vaccine, what do they do? They keep it for 1, 2, 3, 4 and then
excellent. Okay. Any more comments? Nabi, do you want to share your experience with us?
My experience with about the exemption, studied up with guidelines, they said take the vaccine. My recommendation to take antihistamine tablet 1 hour before, just for safety, it will not bring down the immune response or immune response. It will at least give you assurance. This is a good one. That's what we do. For reminding you. So we want to tell patients that if they take antihistamines, 48 hours, 24 hours, take 2 tablets, for example, whatever, and then during the day and the day after, that's it. But some patients are very limited. They want, and the reason there's no rationale behind it, it's just, I don't want to take the vaccine, that's it. And then you all take it. Vaccine. Yeah, what is it? I mean, what makes the patients, happy, but they take the vaccine? And they take the vaccine, but no exemptions. I'll tell you, that's a good point. When we started, we used to keep patients, like for the asthma, we used to keep them 3 visits, we used to keep them 2 hours. Now the patients come in, get their shot, and off they go. First dose, we may actually ask them to wait. I think we wait them to ask them to wait probably 30 minutes or so. But in all hospitals, throughout the world, they don't wait for more than 2 hours. For asthmatics, nothing for urticaria. No, not for urticaria. So in our practice, we just keep them. We used to keep them for 2 hours in the past, and we used to give them EpiPens, etc. This is not a good practice, actually, we found. And we just keep them. Anaphylaxis, I haven't seen it. We have zillions of these patients attending us now. But I'll tell you something. This is really very important. Omalizumab shouldn't give rise to anaphylaxis, because if you remember, if you think of the IgE, which is a Y-shaped structure, omalizumab actually, so this one binds to the this is your IgE molecule, and the IgE for this one receptor has new hormones. Zurin actually binds here. It binds the IgE structure, the IgE, and prevents binding to acid. It doesn't take time to acid. That's why when you stop Zurin, you find that the IgE goes up. The
it's more really available in the circulation. So, anaphylaxis, which means that this is the degradation of cancer, choose one does not bind to the adjacent. Maybe the excipient, maybe the ingredient causes that. It's not clear as such. That is for really not. Any more questions? Excellent. So, look, guys, I mean, I've enjoyed doing this, and I really sincerely thank you for coming. I mean, this is really, you know, an enjoyable event, and I hope that you had a great time, and you're now equipped with the right tools to look after your patients with urticaria in a better way. If there are no comments or questions, I'll conclude our meeting, and I hope to see you soon again at some point. Thank you very much indeed.